Greetings. Let us learn about Zenkers diverticulum. So, when you see a patient who complains of difficulty swallowing, otherwise known as dysphagia, you need to figure out whether it is oropharyngeal dysphagia. That means the patient has difficulty swallowing food once he chews and then he tries to swallow. It doesn't go into the esophagus. It tends to get into the trachea or into the nose. That is oropharyngeal dysphagia. And once it gets into the esophagus, there are a number of reasons why it may not be able to go down. And among those reasons, Zenkers diverticulum is one. In order to understand a little more about Zenkers diverticulum, let us listen to this 82-year-old woman's story. She complains of difficulty swallowing. It has been going on for the last 6 months, and she reports that after eating food, it comes back into her mouth. Whatever she chewed, it tries to come back, and there is no acid taste to the food in the mouth. In addition to food coming back, she also is a little bit embarrassed to share that her friends complain about her bad breath. And she wants you to see the side of her neck, especially on the left side, where she points to a swelling on the left side of the neck. And when she presses on the swelling, you hear gurgling noises. Her daughter reports that she just recovered from a bout of pneumonia just a month ago, having been in good health with no problems until now. So when you hear the story, you should think about Zenkers diverticulum. And let us look at Zenkers diverticulum. You can see the sectional anatomy of the mouth and the neck, the muscles in the neck, and in relation to the windpipe. Let us get a closer look. So as you can see here, the front of the neck, you see the thyroid cartilage, and attached to that cartilage above, you have the inferior pharyngeal constrictor muscle, and below, cricopharyngeus muscle. So there are a couple of muscles attached to the thyroid cartilage and also the cricoid cartilage. Now those are the cartilageous part of the windpipe. And in between those muscles, there is a weakness that allows the lining of the esophagus to come out as a diverticulum. That is Zenkers diverticulum. So this is best seen on a barium swallow study. As you can see here with the arrows marked, once the patient swallows the barium, it tries to collect in a puddle or a sac or a diverticulum, and that is Zenkers diverticulum in the neck. So when you perform an endoscopy, you have to be very careful in anyone with this particular history, or for that matter, in an older patient, because they may have incidental Zenkers diverticulum that has not yet started producing symptoms. So let us look at what happens when you do endoscopy. So as the endoscope goes into the hypopharynx, trying to get into the esophagus, here is the Zenkers diverticulum marked by the red marker, the laser pointer. That is the Zenkers diverticulum. You see a sac, and that's the sac that you saw on the barium study, and that is the same sac you saw coming out between the two muscles on the backside of the windpipe. Cricopharyngeus muscle, inferior pharyngeal constrictor muscle. In between that gap, this diverticulum protruded out. So this is Zenkers diverticulum. And as you look to the left, you see the cricopharyngeal bar, or that one that separates the Zenkers diverticulum from the opening of the esophagus. So when you're doing an exam in an older patient, you have to be very careful and not push your scope blindly, which could result in a perforation if the scope enters into the diverticulum, and you keep pushing and you could end up in a perforation. Be careful about that. I've seen that happen in the past. So an older patient, think about Zenkers diverticulum and be careful with your endoscopy. So how do we manage this? We manage this by cutting the cricopharyngeal bar and opening up the diverticular septum, so as to allow it to enter into the esophagus. And once you cut the diverticular segment bar, this will allow free opening into the esophagus. So we have learned about Zenkers diverticulum, and I would like to acknowledge the support of Dr. John Stroline, Mr. Charles Butt, and Angela Deal, who helped me with this production. Thank you.